We are going to talk about joint injuries, and we will start from knee joint. There are several types of them, but the most dangerous one, it's when somebody gets a hit to the lateral side of the extended knee from the outside, from the side. What can happen? Medial collateral ligament right here connecting two bones is torn, and also those two ligaments, anterior and posterior cruciate ligaments, can be torn. That condition will not repair itself. If those ligaments are torn, that requires surgery. Other common joint injuries, sprains, happens very often. The ligaments in most of cases are just stretched or torn a little bit, and it can be partial tear, and normally it will repair itself. It takes time, but it will repair itself. But if it's a complete rupture, usually it requires surgical repair. Cartilage, that articular cartilage at the ends of long bones, can be torn too because of compression or stress, and those fragments of torn cartilage can stuck into the joint and cause joint to lock or bind. And cartilage cannot repair itself, so this condition requires surgery. Next pretty common joint injury is dislocation. So bones are forced out of alignment. Remember that dislocation of temporomandibular joint when a patient is stuck with their mouth open. It also causes inflammation and pain, immobilization, sprains, so it should be fixed as soon as possible. Now we will talk about other inflammatory and also degenerative conditions. What is bursitis? Remember what is bursa. Bursa, it's a small sac formed by synovial membrane with synovial fluid inside of it, sitting between the bone and a muscle, or bone and a ligament. And it can be caused, bursitis can be caused by blow or friction, and it can repair itself. It just requires a lot of rest, long rest for days and ice, and sometimes, if the pain is severe, anti-inflammatory medications. Next on tendinitis. Tendons, as you know, are structures connecting muscles to bones. And those tendons, or sometimes tendon sheaths, can be inflamed, and overuse usually causes it. As bursitis, it can repair itself with time. You do not need to know that for your class, but please pay attention if you or somebody you know suffers from carpal tunnel syndrome. Tendinitis and carpal tunnel syndrome are two different things. If you want to learn more, go to the PowerPoint and click on that link, and you will learn the difference between carpal tunnel syndrome and tendinitis. Those conditions are treated different. Now we go into arthritis. There are more than 100 of types of arthritis that damage joints, unfortunately, and it's most widespread crippling disease in the United States. All types of the arthritis are accompanied with pain and swelling of a joint, stress, stiffness, and other symptoms. And there are two main types of arthritis. Acute forms are usually caused by bacteria, like tuberculosis or syphilis bacteria can cause it, treated with antibiotics, and usually can be cured within a few weeks if their treatment started on time. Unfortunately, many arthritis are chronic forms. Two main types are osteoarthritis and rheumatoid arthritis. Osteoarthritis is a degenerative disease. It continues for years, it's irreversible, and it's very, very common. 85% of Americans develop it during life, more women than men. Now you will say, well, how so? Because probably that is just a part of normal aging process, osteoarthritis. And those people who do not develop it, they just don't live long enough. Because some people live until their 70s and then die from other causes, and there is a chance if they stayed alive and lived till 90 or 100, they would have developed osteoarthritis. So what happens? We use our joints a lot during life. And overworked joints, it means we're using them too much. Even walking can be too much. If you have to walk, for example, 8 hours every day, it can be too much for your joints. Or sometimes people who carry a lot of extra weight can overwork especially their knee joints. Also happens. So overworked joints, what happens to them? Cartilage becomes thinner. That's the first stage, thinning of cartilage. Second stage, cartilage starts breaking, inflammation happens. That's when usually people notice it. First they're walking upstairs, downstairs, and they feel discomfort, some strange sensations in their knees. For most of people it starts about their 50s. Not necessary, of course. And then at the later stages, cartilage is completely destructed, and pieces of cartilage will be sitting between two bones, causing a lot of pain. At this stage, people sometimes cannot even walk, and they need a surgery, replacement, usually knee replacement or thigh replacement surgery. Hip replacement surgery, of course. Is there any treatment? Not much. All we can do at this stage of development of medical science is to slow down development of osteoarthritis. For that, moderate activity is good. Sometimes when it already starts, mild pain relievers, creams, and also glucosamine and chondroitin sulfate supplements, they can help, but again, only to slow it down, not to cure it. Another type is rheumatoid arthritis. It's very different from osteoarthritis. It's also chronic and inflammatory disease, but it's autoimmune disease. And cause usually is unknown. What causes all those autoimmune diseases? When our own immune system starts attacking our own tissues, thinking that those are pathogens, bacteria or viruses. In case of rheumatoid arthritis, our immune system overreacts and attacks our own cartilages between the joints, between bones. Usually happens between age 40 and 50, but these days more and more often it happens earlier, and it affects 3 times as many women as men. It starts from joint pain, sometimes swelling. Bilateral, it means both knees or both elbows. And at the later stages, sometimes anemia develops, osteoporosis, weakness of the muscles, and even problems with internal organs like heart and other organs. What happens with the joints? Those synovial membranes between the bones, they get inflamed. Inflammation destroys synovial membranes and bones. Cartilage is destroyed also, and bones start growing together, forming connections, which is called ankylosis, at different strange angles. So of course that person suffering from such a severe rheumatoid arthritis cannot use their hands anymore. Not much. It doesn't happen always. In some cases of rheumatoid arthritis, it can last for decades with very mild symptoms. Still, it's a pretty dangerous condition.